Good afternoon, everyone, and greetings from Western Australia, from Perth specifically, where I am today. And I'd like to start off by acknowledging the lands of the Noongar Whadjuk people on which we're meeting here in Perth and to which we're communicating to you from. So, greetings from the sunny West. So my name is Martin Dart. I'm the Chief Information Security Officer for the WA Health Department. Although I actually work for Health Support Services, we are a central shared service provider that the WA health system uses for a number of central technology and also other support services. And I've put some links up here, just some icons of other organisations I've worked in, commercial, federal government here in Australia, and also the university sector as well, both here in Australia and back in the UK. So this is my second year in this position. I'm actually coming up to my second anniversary in a couple of weeks. And for the rest of this presentation, I just want to talk you through where we've come from, what kind of organisation we are, and really how we're looking to move forward into the future, not necessarily just based on our current reaction to COVID, but hopefully some more strategic kind of approaches that we want to take to the problems of security. Now, the challenge for us, of course, is that this comes, as difficult as COVID is, for us it comes on top of just our BAU overhead. So this is a bit of an overview. This is what WA Health looks like in a number of areas, both in technology. So I've just mentioned on here, we have 1,000 software applications, 2,000 servers. We have an organisation within Health Support Services of several hundred people who support that. And that's just the one component of the 44,000 staff that the WA health system engages in all sorts of clinical and support areas. And we're across one of the largest geographies, and I think we do claim to be the largest physical geography in the world for any health department. So we have that problem not just of normal scale of operations and all the clinical things we have to do, but the places we have to do it, the places we have to get to, and the stretch we have to place on our infrastructure and our resourcing to make that work in the sort of geography that WA has. That's an ongoing challenge. You can see it's not cheap. The WA government now spends $10 billion a year just in health services. So we are the largest government department in Western Australia. We do employ the most people. We probably have the oldest technology. We probably have some of the newest technology as well. We do have innovation, and a great deal of that goes on in the clinical space. And our doctors are very keen to partner with research organisations, new vendors, new technologies, IoT, medical IoT. We have all of those opportunities within that organisation. But at the same time, of course, we are trying to deliver services. We are a health department. We deal with 1 million emergency presentations a year here in Western Australia, 25,000 births, 86,000 surgeries. So in the middle of all of that legacy management, innovation management, paying all those people, dealing with people, of course, that are off sick and go on holidays where they can, we also have to make sure that the lights stay on. And as a shared service provider, Health Support Services has that central responsibility, in effect, that we need to be able to surge where we need to surge. We need to be able to bend and flex where we need to bend and flex. And really, we don't know a lot of the time where that demand and that requirement is coming from. And sometimes it just sneaks up on us and we go, well, we didn't see that coming, but we need to deal with it. So it's not an organisation or an environment, I think, for the faint-hearted. I think other people maybe in this audience who work in healthcare can recognise their own organisation in this type of contradictory sets of requirements. You never know who's going to be knocking on the door next for dealing with the next big thing. And just by way of illustrating that, I did a little experiment just last week. I fired up my little test instance of Multigo, and I thought, look, I'll just look at some of our public-facing infrastructure. I'll see what other people can see from the internet, I guess, if you run this kind of scan against this. So the little blue balls on here, those of you that are familiar with the tool, you recognize their kind of domains. They're the top level namespaces within which there are departments or organizations or some subset of infrastructure. So I've actually zoomed in really here just on a small part of what our network looks like. I've expanded a couple of the top level domains, and you start to see that within, it's kind of a worlds within worlds type scenario. There's infrastructure, there's email addresses and email infrastructure within those domains, and they have cross relationships with other domains. And as you can see, there's a number of the blue spheres in here which I haven't expanded because they just wouldn't fit on the screen. I mean, just expanding these half a dozen makes it kind of unreadable, but it's an indication of the type of complexity and the type of interrelatedness that we know we have to deal with on a regular basis. And as I said earlier, there is some of these connections and some of these domains will be new and innovative, and there'll be partnerships with commercial organizations and research organizations, and some of them will just be dyed in the wool, bolted on, rusted on legacy stuff that hasn't changed in 20 years and probably can't change in a hurry because it's underpinning or servicing a real fundamental requirement of our organization. And maybe the people who installed that stuff and the people that kind of configured it are no longer around. So we really have to work around and be very careful in dealing with some of this infrastructure. So nothing is easy to change. Now, having said that, of course, the organization looks at it, well, yeah, we still expect you as a chief information security officer, as a central service provider, to take all of that complexity and just kind of fix it, give us some of that good security stuff. We actually are doing the strategic plan for ICT at the moment within health support services, and there's a number of projects listed. And, we look into the innovation space and we say, yeah, we're going to do medical imaging differently. There's a special project for that. We know that our HR services and HR systems are a legacy, so we've got a mitigation program and also an upgrade path for those, and that gets a specific budget and it gets a number of people working for it. But then also on that strategic plan for ICT, we just see information security. And when I first saw that, I sort of said, well, what's that? Is that going to get some special money or some special attention? And the other executives just kind of said, well, no, we've spoken about it and we've looked at the context of all these other projects and we just want them to be secure, please. And that's as far as they go in terms of defining what that needs to be. But if you think back to that previous slide and also some of the services before that, which I explained, it's like, well, trying to apply just security to all that is pretty difficult. So that's part of our everyday challenge. And I think this illustration of the Rubik's Cube kind of encapsulates really what it's the challenge and the opportunity. If you can solve it, it's going to look fantastic. But your chances of solving it as a holistic puzzle are pretty remote. So you're going to have to look about, well, how can you resolve bits of it? Where do you need to focus in effect? Now, the traditional approach to this, of course, is to do something like this. Yeah, we'll solve your security problem because we'll paint a bit of security over here, we'll colour that in, we'll wallpaper over something else, we'll sweep some other stuff under the carpet, and it will kind of look okay. It will look a bit like a solved problem, but whatever you do, don't scratch the surface, don't touch it, it's still wet, you need to be delicate around it. And I think the days really where security could get away with that are probably long gone, because we don't hold the keys to the infrastructure anymore. When you did run the servers yourself and you had your own data center, you kind of knew where the bodies were buried and you could work around it. I think now where there's much more of an environment of partnerships, cloud services, and certainly a huge amount more demand from the organization, you've really got to come up with substantive and long-term solutions. But that's not to say that as an organization we don't have a lot going on. We've got in-flight programs, and I've just picked a few here as a kind of an example. Of course we're doing the migration to cloud, but everyone's doing a migration to cloud. This isn't new or innovative really in any substantial sense. We do it at scale maybe that's different from other people. But you've all done it, so you're aware of the problems and the challenges that presents. Digital transformation is kind of a buzzword. We're as guilty of it as anybody else. We want to do different things with our data. We want to deliver our services differently over different platforms to people. So that's nice. But again, lots of people are doing that. It's not difficult to do. It's not difficult to find people to work with you in the marketplace to do those sorts of things. And of course, we're doing really just like everybody else across the whole country. We've had to do a COVID response. We've had to do work from home over the last 6 months. It was certainly a stressful experience to ramp that up quickly. We had to send several thousand people to work from Windows virtual desktops from home. We had to ramp up the licensing, of course, on our VPN connections and procure a number of laptops. And in fact, we got a preferential hardware procurement agreement within the state of Western Australia from the hardware suppliers, from the supply chain, to actually get us the laptops that we needed as part of that COVID response. But again, not unusual. That same experience, that same reaction has been experienced by a number of people, and maybe some people have done it better or they've done it differently. But it's not, I think, a unique enough experience maybe to talk about today, because you will hear about that from other people within different organizational contexts as well. Which, of course, does lead us to the question, so what is new? What is WA Health doing? How has it changed its approach to kind of solve some of its fundamental problems? That's what we'll have a little look at moving forwards. And if I had to sum that up in one word, I think I probably would pick the word attitude. I think it's the approach, and I don't mean attitude in, a kind of negative or an aggressive sense of having a bad attitude or an aggressive attitude. I think your attitude, though, your approach to the way you deal with that complexity, you deal with the frustration and you deal with the challenges that come from an organisation like WA Health, which certainly can be infuriating, hugely intimidating, and just, you don't know whether to laugh or cry sometimes. You have to have an attitude that can deal with all of those frustrations and all of those problems. We do see people that come into the organisation, they find that such a challenge and they can't adjust to that way of working, that they tend not to stay around very long. And that's fine. I mean, if you don't have a personality that can deal with that, then you're just going to have a miserable time at work. So there is an attitude adjustment that takes place when you come into an organisation that's this big, this fragmented in an operational sense, and particularly for WA across such a large geographical area. You've got to recognise you're not going to be at the centre of every meeting and every decision and every design. Other people are going to be doing things all the time that you have no visibility of until they go live or they go wrong, and then they come knocking on your door and say, yep, we've made a mistake, we need you to help us out. You have to have an attitude of welcoming those people in and welcoming their engagement, even though it comes at a time that perhaps is not as optimal to you as you kind of would have preferred. So I'm really started to think about this really for the first time for this presentation, and I think I've kind of arrived at 3 types of approach that have served me well in trying to understand and just ride the waves of this organisation in all of its scale and complexity. These are 3 approaches that I think now I try to explain to other people, which are non-technical approaches really. Approach number 1 here, for example, the organisation had commenced on a pretty large commitment to cloud when I started work here. So we're in the next 10 years looking to spend $100 million in terms of cloud application migrations and infrastructure migrations onto cloud platforms. So there was very much a belief, again, that, cloud is the default, everything can go into cloud. And very early on, I wanted to kind of build the attitude that not all clouds are the same, not all clouds are secure, and we need to treat them in different ways depending on the type of information that we want to share. So my first point here, I started to draft a cloud risk policy really as soon as I arrived in the role, and that iteration and that drafting went on for about 18 months between myself and the Department of Health, who issue policy across the state. And, there was the usual kind of bureaucratic toing and froing about formats and legal approvals and all that kind of stuff. What really forced the issue was, last month, a media organisation identified and brought to our attention a data breach. So we had a system that was sending information out, really too much information that should have been sent. Now that, of course, creates an environment where the executive of the organisation comes together and they start to ask questions about what's gone wrong here, how do we fix it, and systemically, what more do we need to do? So when I was in that role, in that room for the first time, really, I kind of stuck my hands up and I said, look, we've been trying to change this culture. Sorry, I should have said that the data breach was facilitated through a third-party cloud messaging service, a subscription that had been around for a long time. Again, I stuck my hand up and said to the Director General of Health that we've been working on this problem for the last couple of years. I recognised early on that it's a cultural and a behavioural challenge that the organisation has. People stick things in clouds and then don't think about them again. They don't revisit the contract. They don't consider the risk, whether it changes or not. So I said, look, we've got the policy. If we release the policy, part of that requirement is that we start to establish a register of cloud services. All new cloud services have to be lodged into that register through my department, so we get visibility of where people are putting things, and we ask them to address simple questions. Who is authorizing this data to go here? What classification does the data have? Does it have special handling requirements? And if that cloud service is unavailable for whatever reason, how will you continue business? Is there a BCP plan in effect? Now, within 72 hours of the data breach, that cloud policy went live. So we now have that. This was a month, 6 weeks ago. So this cuts across the independent agencies that make up, quasi-independent agencies that make up the health service. Each of the we call them health service providers, has their own board. So they have their own risk assessments, and some of them have their own policies. This is a policy that applies to everyone at the top of the department down. So it's really useful for us to have this as a bit of a baseline. It helps us understand how people are using cloud. The second part is really about cloud as part of that platform as a service, security infrastructure, security management as a service that now we typically get from cloud vendors. We don't run really many in-house boxes, and we don't buy devices that sit on your network and do much monitoring. All of these are now available as cloud. But what we found, and I get lots of approaches and still do, from a vendor that sells you one product that says, we've got an add-on and we can do something else and then something else, and we can in fact be your vendor of choice. You don't need to go to anybody else. I think I've arrived at an approach now, and my attitude is I don't think that's particularly healthy, or I think what we need to do is challenge those assumptions from the vendors. Because what we see is a vendor that can do one thing really well, who then procures a technology or buys into a partnership with another vendor, may not do that second thing in the same way they did the first. So as I've pointed out in the example here, maybe the people that provide you your enterprise collaboration service, should they be the people that also provide you with your SIEM service and your email protection and your DLP and your CASB? Because when you think about it, the vendor that's running your email verification service, if they're also selling you the email service itself, are they really going to tell you that their own service really is suboptimal? Sometimes I think it's useful to have that little bit of friction that occurs when you have different vendors, and one vendor is of course looking over the other vendor's shoulder, because from their perspective they're thinking, is there a business opportunity? Can I get in here if I can disprove the other vendor as being effective? So I think using that in a constructive way and really asking the questions about, do we have the right vendor? Do we have the best of breed to meet what the business outcome or the security outcome that we're trying to achieve? And I do find in some of the consolidated platforms from one vendor trying to do multiple things, they sort of call it one product suite, but you do tend to get different dashboards and different screens, and it can be hard to get the consolidated view, which I sort of ask, at my level, I sort of go, well, look, what's gone on and what does it mean? Just give me that picture, give me that one slide or that one diagram that illustrates that, because then I can take that to the executive and, make a business case for changing things. So that can be a bit of a challenge. So this second approach here is really about trying to understand the environment and really consider what information we can infer about really what we're seeing from a number of sources. So again, this isn't a particularly new concept. Some of you will recognize this concept of observe, orient, decide and act, also known as an OODA loop, also sometimes called a Boyd loop by the person who identified that, John Boyd, back in the Korean War. So again, not a new concept, but really it's about a process, the 4 stages of this that you really need to be able to complete to be able to go from that process of, seeing something, understanding the concept, looking at your options, and then really doing something meaningful. And there's a bit more of a detailed description of it on the screen there, which certainly won't go into all the processes of that, but it's about going through each stage and then providing a feedback going, well, do I need to observe more? Can I proceed to acting? Once I've acted, can I, through the feedback loop, observe that that action has actually made an impact? So we do this in a number of areas, or we're starting to improve this maturity. So some of the questions we ask ourselves, what are we seeing via email versus what we see on the remote access logs? If we don't see anything there, but we're seeing something perhaps that's a large amount of data being moved from our cloud instance to a workstation or another location, maybe that's an indication telling us something that the email logs and the remote access logs haven't. So you need to have multiple kind of channels to look at this type of information. We also then try to look and try to infer information from our patch levels and vulnerability management, threat intelligence feed, and open source data breach notifications, because that at the end of the day may be the one kind of indicator that we have a problem that nothing else has told us about. From the business perspective, of course, they're concerned about, well, is there something that needs to be escalated? Do we have more risk this month than we had last month? Who do we need to alert? Who do we need to contact? So I'll show you in the next slide something really that's just one little example of that. So here's an example of really what that looks like operationally for us. So this is a platform we've had for several months now. We've certainly come to rely on this throughout our COVID period, particularly because we saw a lot more email-borne threats throughout that period. But this gives us an indication just of 2 months. So July versus August. In August, we saw, a fair bit more email, another 500,000 more emails potentially coming into our organisation, but we delivered fewer of them. And it's only looking at the sort of threat profile that sits between those 2 statistics that we start to look at, we've got double the amount of URL threats that came in that second month versus the first month, 3 times more IP reputational threats. And we can probably infer that, email is a channel that's experiencing a challenge at the moment. There is more campaign activity, there might be more targeted activity. And through this platform, we can also start to look at who are the people that were attacked the most. We call them our very attacked people. And we notice that changes month to month. Sometimes it's clinical people, sometimes it's admin support people. Why is that? Is there anything that's happening in terms of the organizational activity that supports that kind of analysis? And what it gives us an indication of, although we don't have the precise nature of what's gone on with that extra 500,000 kind of emails, what we do know is that something strange is going on. So we'll start to look for other indicators in other areas to verify that information. And the little quote at the bottom just made me realise maybe Shakespeare was the world's first cyber analyst. Sometimes you just know, you kind of the tingling in your fingers, you look at those statistics, you go, yep, it's not right, something's coming, and something's going to crack open the locks if we don't look for the risk and close that risk as soon as possible. So this kind of ties into the third part of this approach, because of course we can see things, we can make observations and recommendations about how we think the world should change or needs to change, but we need partners really to implement that and make it just a part of the culture of the organisation. Otherwise we're just playing whack-a-mole, we're waiting for the next thing to go wrong so we can react to it. So what we find is really important. We try as a security function to be as engaging and to communicate as much as possible. We look for operations to collaborate both across our business, more broadly across government, and then also specifically, with technical partners, people that can give us new capability. So we're looking to discover like minds in effect. Because, what I've kind of captured here on the slide is that all of our organizations really have this same secret. No one really understands the security function, and most of them, in fact, fear it because, you tend to be the no police. We're telling people not to do things, or we're going to, produce a report or a function that tells them off in some way. People don't like that. But also, I think most organizations definitely have a realization now, because they read the news and they see what's going on, that they can't do without a good security function. We really are, as the diagram shows, with a fig leaf that spares their ultimate blushes. We stop everything being displayed in the public domain. So we know we need it. I think the way we're trying to change this dynamic through the partnership and communications is that we're trying to move away from being, like the policeman, telling people not to do things, to be more like a mountain guide. So we're saying, yep, you can climb the mountain, you go for the highest peaks and get the best views, but we're going to tie the ropes on for you. So if you make a mistake and you fall, it's not a fatal fall. We can stop the ultimate disaster from happening. And we find that that's a culture that works best for us. These are just carrying on from the previous slide. These are just a couple of approaches really in that communications and collaboration space that we found have worked well for us. I think having someone else voice the message, we have a great comms and change person who works for us, who helps articulate that really in normal language. We don't put tech speak, or if we do, she takes it out for us and she engages through Yammer and newsletters. She runs a lunch and learn program that articulates what the security team are trying to do and the behaviours we want to encourage in others. That works really well. I think also this second point, auditors really are our friend, particularly in government. They are a report, they are an entity that our executive listen to, and very often there is the case that we say there's a problem. Our executive go, yeah, but there's no resources, you can't fix it. Then the auditors come and say there's the same problem, and suddenly the resources become available. So audit reports and being engaged in the audit process is proving very useful for us because it helps us steer the expectations and it helps us respond to those audit findings as well and use the remediation capital and the resourcing in the most effective way. Using business change management process. Now for us that actually is a separate team. So change management again is not a technical or technician's sort of purpose to deliver. We found if we can explain it to the change management people and they can take a security initiative and engage with end users, stakeholders, that people will probably listen to them more than they would listening to us as the security nerds who tell them that you've got to do something differently. So that change management process and benefits realization is really useful. And typically what we're doing now, particularly in our, we're running a bit of a security program, is that there is an initiative, there is some analysis. I will sign off on that maybe as the departmental head, and then I will hand it over to the change team to implement, because they have to go out and figure out, well, who cares as end users and what are we going to change for them. This kind of leads on to the fourth point. You need to be discussing throughout this process options with the business. Don't be doing things to them that they don't understand or they don't really respect the point of. You need to let them feel that they are making decisions that impact their daily life. Now, that may not necessarily be the case all the time, but we have to take them on the journey. You can't just rock up and go, yep, stop doing that thing, start doing this thing, and we're going to start monitoring and implementing a compliance regime if you breach the new working activity. So definitely engage with the business early. Keep them there as part of the deployment process, use that change management process to integrate with them and communicate with them on a regular basis as well. And my final point here in terms of the collaboration and the communication, we found great partnership with university placements. We work with Edith Cowan University over here in WA, and we do run for typically master's students in their last semester of their final year. So, we look for people that are doing well in their course, are interested in coming into an organisation at some scale, and we give them a 12-week placement, and we put them at the coalface. We really use them in a positive way. We expose them to the problems of the customer and all of the contradictions that come in an organisation of our size, and ones that show interest and promise and want to be engaged. We've now got 3-4 of them that have come on with at least temporary contracts at the end of their course, because we recognise they're really valuable in bringing new initiatives and new ideas that can really help the business out. So I would certainly look and recommend looking to those sorts of partnerships as delivering additional value. This next slide is really just a summary of the communications point, because I started thinking about this the other night and I thought, what's our communications been like the last few months? What messages have we been putting out there? So I went and copied and pasted all of our Yammer feed posts and some of our email newsletters and some of the other comms that we send out to our executive, and just put them into a word cloud generating list. And I thought, well, how do we come across? I think this is the sum of how we're perceived by the organisation. And not surprisingly, we've spoken a lot about health and the health department. That's our business at the end of the day. But the two other biggest words there, which of course relate to frequency, are that we talk about data breaches, because that is a problem within healthcare broadly, and we talk about it as being a risk to the delivery of those health services. So we're trying to say that security is not an abstract problem. This is something that if we get it wrong, will have an impact on patients and doctors and nurses and people that work in clinical environments. There is some research that we referred to and we included in one of our communications that looked at data breaches at hospitals across the US and observed that in the months and years following those data breaches, there was an increase in the mortality rate in those hospitals, because of course people trusted certain systems less, or some systems had to be retired. And in a data breach situation where you're responding both to media and to customer end user concerns, it's quite difficult to do that in a planned way. You're reacting without much time to think about that reaction. So that can have really dire and negative impacts for patients, the people that really rely on our services. So that was interesting. And I think in terms of looking at this cloud as well, I was quite pleased, pleasantly surprised that a number of the sort of softer words were coming through. We spoke about being a team, about being a trusted advisor, about delivering services that can protect data, and that we're committed. We want to be part of that discussion and part of that relationship. So this was good. I'm going to share this with our comms person and really try and develop more of that type of messaging, and I'd maybe encourage you to do the same. So finally, I just wanted to sort of look into our future really and highlight some of the challenges we know we've got coming up in the short to medium term. And working down this list, we need, there is going to be a search for a new CIO for health support services. We lost our last CIO a couple of months ago. Of course, a new executive director at that level brings a new culture, a new set of priorities. So we're going to have to be ready to adapt to those. But there is also this consultation taking place at the moment with the Commonwealth with regards to healthcare becoming a new definition within critical infrastructure. And for us, that will require more oversight from the Commonwealth area, probably more of an audit requirement and an uplift in the standards that, although at the state level we've certainly been trying to mature that the last 12 to 18 months, I think this is just going to give that a significant boost. So we're going to have to be able to do more and report on more. Now, our third point here is that we have been looking at this for a couple of years, and we've had a security project running which helps us remediate certainly OAG findings, other audit findings, and just some of the fundamental security issues that we just struggled to resource or have the space to define as part of BAU. Now, our funding for that and our timeline is now getting down to the last 9 months, and we've really got the big issues to resolve. Cloud access security broker, DLP, user education and training, all those things. So we know we're going to have a huge focus on that in the next few months. In terms of COVID, we just don't know. In WA, we've been lucky. We've had the hard border, and our initial wave wasn't significant. The consequence of the lockdown certainly was for us, because it meant lots of regional travel was restricted here. Now, if we do get a second wave and we return to that kind of environment, how do we deal with that? How do we deal with it, particularly if we go through the experience Victoria has at the moment of the hospitals become critically loaded? And that's something I know that the UK saw when they had a big surge in COVID cases. You start to have reduced oxygen supplies. And for us, in our geography as well, the management of that supply chain is always going to be a problem. If the second wave becomes a third wave, fourth wave, or just an ongoing pandemic, there is no cure for the virus, then the current state of emergency that we're in almost becomes BAU. We're always going to be in that state of emergency. So how do we manage that in terms of the response at the moment, which so far this year has cost us, the best part of $9 million? Does it require another 9 million? Does that 9 have to become part of our next year's funding? That's a challenge for us to understand the consequences and to plan for it. In terms of that second last point, we're always going to be herding the cloud cats. There's just more cloud stuff happening all the time. We're working through a process at the moment. There's a financial system that's an industry standard that's moving from an installed platform to a cloud platform, but the cloud platform has overseas backup requirements. Particularly difficult when you're trying to transfer employee PII over those sorts of systems. So we're being asked to consult a lot more and to work with vendors to review privacy clauses within contracts, to complete risk assessments. There's just a lot going on in that space as well. And the last point, of course, is all of the above requires funding. Both project funding, BAU funding, COVID response funding. How does it all tie together? And while we are a $10 billion a year system, the money that gets spent on ICT and particularly on security, the clinicians look at as money that is not spent on the elderly or newborn babies, whatever the critical care requirements are. So we have to always be careful about justifying and showing the return on benefit, really, for the money that we do spend. So that's the end. That's my thoughts on the world. Thank you very much for listening this afternoon. And if anyone has any questions, I'm happy to receive those. I think that comes via the moderator. And if anyone needs to get in touch, please LinkedIn me and we can have a chat offline.